Thank you. My name is Elizabeth Foss. I am an occupational therapist with a strong passion for working with individuals who have ataxia. And I feel so blessed to be here. I really do. So honored. So today's workshop, we're going to alternate between doing some exercises and then education. We're going to jump back and forth. For the exercises, we're going to do some tai-chi, some proximal stabilization with coordination, and then sensory boxing. For the education portion, we're going to go over research articles, but I like to transition them into stories because that's why we're here. And that's the importance of this research is the people. And so I'm just kind of transforming that into stories. Throughout that is going to be a lot of application. I remember the very first support group I attended, I thought I was going to support, and I thought I would be in the background and just cheer people on, and I learned from the community. And instead what happened was we all introduced ourselves, and she said, all right, and next is Elizabeth Foss. Let's turn our attention onto her presentation. And I had no idea, and I didn't really have a presentation. Luckily, I have a lot of spaghetti in my head, so I just pulled out a bunch of research studies and put them together. And then at the very end, one of the women, she just said, this was so helpful, but can you give me some exercises? What can I do? And I didn't have anything ready for her. I didn't have a list. I didn't have videos or handouts. And so today, I do not come empty-handed, but I have a lot of resources for you. A lot of videos. These videos are on my YouTube channel, Little Steps, Big Gains. And I'll kind of explain that as we go along. So the first thing we're gonna jump straight into is some tai-chi. Now, it's up to you. We are gonna be reaching around, so it's up to you if you wanna move your chair to give yourself a little more room. We'll be reaching with our arms, kicking with our legs. That's up to you. When we think of core strengthening, sometimes we think of crunches. Let's get that core going. But how are crunches gonna help you drive? How are they gonna help you reach up to grab that glass? We need proximal stabilization, yes, but our core is a cylinder. We have the abdominals in front, we have the back extensors, we have our pelvic floor, our diaphragm. We're a cylinder. We're not crunching. So we need our back exercises, and we need to stabilize proximally so that we can move distally. So it's all about being centered, and we'll talk more about that. The purpose of our Tai Chi is it's going to be fantastic because Tai Chi is about a lot of slow, mindful, and then posture. And so we're gonna walk through some of those together. Now, when it comes time for Tai Chi, everything is slow on purpose. It is, if I just reach to grab something, come back, my body didn't really have to recalibrate during that at all. It was real quick. But if we reach slowly, how much does my body need to recalibrate to offset that? Tiny little degrees along the way. So the slower we go, the more difficult it is, which is fantastic for us. So we'll go through the Tai Chi first. We'll go through some coordination, and then we'll jump through some sensory boxing, and I'll explain that when we get there. Okay, so for our Tai Chi, the very first routine has 3 exercises. We'll do them together. Our hands are together. We're going to breathe in and bring those arms all the way up. Breathe out, bring your arms around, down, squeezing those shoulder blades and back. This is called a good morning stretch. So breathing in and up, out, around and down. And Allison just talked a lot about breath support, so this is fantastic for that. Our second move is going to be draw the sword. So we're gonna take one hand into our pocket, the opposite pocket. We're going to breathe in and open up, expand that chest, stretch, and then we'll breathe out and we'll close it up. We'll do one arm 4 times together, and then we'll do the other arm. So switch hands, it's in your opposite pocket. We'll breathe in and open up. Breathe out and close. Good. And if you're doing this supported, that's fantastic. If you want to challenge yourself a little more, then do it unsupported, but put your safety first. And then the third one is our cross body. So now we're gonna add some rotation in. Our hands are up. We'll breathe in first, and then take one hand. You're gonna rotate, reach across your body as far as you can. Breathe in, back to center. We're gonna rotate, take that hand, reach across your body. So you breathe out, and then come back in. And we'll go through 4 of them together. It's really slow, which makes it fantastic for our proprioceptive system, and fantastic that we can work together for our balance. So let's go ahead, Alex, and start the music. Good morning stretch. Ready? Breathe in, out. Squeezing those shoulder blades and back. 3 more. Breathing in, breathing out. Breathing in, breathe out. 1 more. Breathe in, breathe out. So good. Hand in the opposite pocket. Breathe in and open up. Breathe out. Same arm, okay? Breathe in and open. Good for our posture. Breathe out. 2 more, ready? Breathe in and open. Breathe out. 1 more. Breathe in. Really open up your posture. Breathe out. Let's switch arms. Everyone looks great. Breathe in. And out. Good, we all need this. Breathe in. Out. In. Opening up that chest. One more. We're breathing in and out. Cross body, put those hands up. Breathing in, rotate, cross and reach. Back to center. Rotate, reach. Back to center. This is fantastic for us. Rotate, reach. Back to center. Breathe out. Rotate, reach as far as you can. Rotate, reach. Oh, fantastic. Fantastic. Okay, now we have a little bit of coordination and core, obviously. So for this one, we're gonna pretend, I do a sitting balance with a broom, so we're gonna kind of pretend we have our brooms, but our arms are gonna go up straight in front of us. We're gonna bring them a little bit further out than shoulder width. One elbow, we're gonna bend our elbow and drop it back. So if you look at me, I'm dropping it back and down. And then we're gonna be bringing it forwards. And then we'll switch. Bring that elbow back and down. Now level 1 is to do this supported, and that is amazing. Level 2 is to do it unsupported, and level 3 is to kind of rotate and lean back into it. And that's really difficult. And we're gonna go nice and slow, really remembering that posture. We're not collapsing, okay? We'll do the arms. Then we'll rotate to the legs. This looks simple, but it's not. Our hands will be behind our head if you like, just not pulling on the neck. We have to maintain our upright posture while we kick our leg. Very slowly lower. Do not collapse. Maintain that posture and slowly lower. It's not easy, all right? Then we're gonna try to combine it. So as we bring one arm back, you're gonna kick the opposite leg. So if it's your right arm, it's your left leg, it's opposite, okay? And then switch. Bring one arm back and kick up the opposite leg. And that's actually not easy. We'll practice one more time. Bring back the arm, kick the leg, tightening your core muscles, right? Oh, got those. Ready? Tighten those core muscles. It's opposites. Okay? Just to make you feel a little better, my husband suggests that I do something creative and non-productive, which is very, very difficult for me. So he signed me up for dance class, and I did terrible. There was one spot, and I was in the back left, and I'm actually completely deaf in my right ear, so I couldn't hear anything, I couldn't see anything, and about 45 minutes in, I was kind of getting the hang of it. I would give myself like a C-. And then at the very last song, instead of stopping it, she just kept going, and she said, "Now everybody freestyle." And I said, "What the heck is freestyle?" So I tried my best, and I went home and I told my husband, I said, "Oh my gosh, I did terrible." And he said, "Elizabeth, this isn't about outcomes. This is about reconnecting with your body. It's okay, you're not getting graded here." So it's the same thing, if you're kicking the wrong leg and punching the wrong, it's okay. Just smile, just try your best with me, okay? And we're not gonna freestyle here, okay? All right, so we're gonna go ahead and hit it, Alex. We'll do just the arms, just the legs, and then both. All right, ready? Take that elbow, back and down. Tighten those core muscles. Switch, back and down. Tighten those core muscles. Back and down. Woof. Back and down. Back and down. Looks really good. Let's go one more with those arms. Okay, ready for the challenge? Okay, kick that leg with me. Up, yes. If you need your hands down, that's okay. Just try to keep upright. Try not to collapse, okay? 2. Tighten those core muscles. Core muscles. Not easy. Fantastic. Everyone's doing so good. You ready to try to combine it? Oh, just try. One arm back, the other arm kicks. Leg kicks. See, I already screwed you up. One arm, opposite leg. Tighten those core muscles. Tighten those core muscles. Good. Pull back and kick. Back and kick. Just try your best. You look great. Back and kick. Tighten those core muscles. Fantastic. We're almost there. Oof. I got to finish the other side. Oh, fantastic. That is not easy. Coordination, posture, everything. Fantastic. Okay, our first round of sensory boxing. This is a little bit different. Now, in order to maintain our balance, we have 3 sensory systems that kick in and tell us where we are in space. Are you to the right? Are you to the left? Are you up? Are you looking? And all 3 of those systems kick in. Our visual system, hey, you're falling over. Our somatosensory system, the feeling in the bottom of our feet, our sensation. And then our vestibular system in the inner ear. All 3 of those come in, and guess who organizes all of it? The cerebellum. And so part of sensory boxing is using some of those sensory systems, taking them away, incorporating them, forcing the cerebellum to get a little better at organizing them. So if you get dizzy with head turns, don't do the head turns. But if you can, we'll try them together. So the first round of boxing is going to be, we're gonna cross punch, then we're gonna march, kind of a knee, and then we're gonna duck. And when we duck to the side, our hands stay and our body goes. Duck, duck. Okay, the sensory part comes in with the head. If you can turn your head while you're punching, turning your head while you're punching, if you don't get too dizzy, all right? And then the march, or knee, and then duck, and we'll kind of hold it there. We'll go slow together. We'll try to speed it up, and then we'll go slow again. All right? All right, Alex, I think we're ready. Okay, ready? If you want, look, punch, cross your body. Look, punch, across your body. Okay, knee, ready to duck, duck. Get those core muscles going. Woo. All right, again, look, cross. Look, cross. Knee. Ready to duck, duck, duck. Again, ready? Look, cross. Look, cross. Knee, duck, duck. One more time slow, ready? Look, cross. Oof. Look, cross. Knee, tighten those abdominals. Knee. All right, duck and duck. Now, if you want to try, go at your own speed. Try to speed it up, all right? At your own, so it's cross, cross, knee, duck, duck. Just try your own pace. Everyone looks great. One more fast. Okay, whew. All right, let's slow it down together. Ready? Look over, cross, punch. We're like slow motion action movie. Cross, knee, duck, duck. All right, look, cross, march or knee. Ready, duck, duck. All right, one more, cross, knee, duck, and duck. Oof, awesome job. Okay, very, very good. So that was our first chunk of exercise. So we can take a little break and talk about a little bit of stories here. So our first exercise chunk is education chunk. The big question is, first off, is exercise even effective for ataxia? And so we're gonna break that up into classifying. So ataxia might be classified as acquired or inherited. And so our first chunk is gonna be, is exercise effective for acquired ataxias? And this would be individuals maybe who've had a stroke, a brainstem tumor, a traumatic brain injury. So I have 3 stories for you. Story number 1 is about Mary. And these are, once again, so these are research articles. So they are real research, real articles, but I'm giving names. So this is a case study. Her name is Mary, 51-year-old healthy female. She had a stroke, so she had an occlusion of her blood flow that affected her cerebellum in the back that caused massive brain injury. They went in to do craniotomy to remove the damaged tissue, and she ended up getting hemorrhages and all this fluid buildup, had hydrocephalus, and out of her prognosis, which could have been good, fair, or poor, the doctors gave her a very poor diagnosis or prognosis and said to go ahead and look at palliative care, which is kind of end of life or comfort care. She had weakness, whole body ataxia, double vision, dysphagia, difficulty communicating, and emotional ability. Instead of doing palliative care, she did rehabilitation and agreed to be a case study. She, after 14 months, walked out with what's called standby assist, meaning her husband was next to her. They gave her her clothes at setup. She got dressed by herself. And then she was standby assist for toileting. So it's just so fantastic, showing that even though we have damage to one part of the brain, we can route new pathways around it. That's called neuroplasticity. So is that just one case study? You know, is that an unusual case? That's what Dr. Kelly, and his real name is Dr. Kelly, wanted to know. So he did functional recovery rehabilitation after cerebellar strokes. So he took 49 individuals who had moderate impairments from cerebellar infarctions, and he looked at all of these cases, and at discharge, 80% of them left with minimal to no impairments, 66% left and were discharged at the independent level. So he concluded this data confirms extended previous reports that indicate excellent functional recovery amongst cerebellar stroke survivors. And last is for traumatic brain injury. So William, he had a traumatic brain injury from a rock climbing accident, and he and 19 other individuals were recruited to do a research study and look at inner and inner limb coordination, postural stability and gait. Could these things help with his ataxia? He did 20 sessions, 60 minutes each, 4 to 5 times a week. And him and the 19 other individuals, they did improve in their static and dynamic postural stability, their gait. They had a reduced truncal, upper, and lower limb ataxia. And so, of course, I wanted to know what the heck the exercises were. So I got the list of the exercises from that research study, and I had a beautiful young woman, Ellie Martin, over there. I videotaped her doing the actual exercises they did in that study. And I have those up on my YouTube channel and use those exercises for my challenges, my 30-day challenges, which we'll talk about, because the goal is not 30 days in a row, but getting the exercises they actually did in there. So rehabilitation is absolutely effective for individuals who have had acquired ataxia. Next, we will talk about degenerative forms, inherited forms, progressive forms of ataxia. So we'll talk about that next. But first, we'll go back into our exercise. So our first tai chi, we're gonna do 2 moves, and I like a little bit of continuity so your brain isn't spinning so much. So we are gonna do our good morning stretch again. We'll be breathing in, breathing out, around and down. Okay, we know that one, beautiful. Now is roll the ball. We're gonna hold a ball on each side. Our hands are holding this. One hand is going to go ahead and it's going to start to roll it across your body. So we're going to be rolling that ball all the way across. One hand is on top, one hand is on bottom. And then we're going to be coming back. And when you come back, your hands are horizontal again. Now take the other side, roll that ball all the way across and back. So now we have a lot of rotation. You could do this supported, and that's amazing. You could do it unsupported, which is that next level up. Both are fantastic. So good for our core. So I'll do it with you where we will breathe in, and then we'll breathe out, and we'll breathe in, and I'll walk you through it. We're gonna do 4 of each, okay? This is so good. All right, Alex, we're ready. Breathe in and out. Squeeze those shoulder blades. Breathe in and out. Good posture. Breathing in and out. Do one more. Okay, let's hold our ball. Ready? Breathe in and rotate. Breathe out. Breathe in and rotate. And out. In and rotate. And out. In. Out. In. Out. out, in, out. We'll do one good morning stretch. Ready? In, out. Good. Fantastic. That rotation, so good for us. Okay, back to coordination. So first round of our core coordination, we had our hands in front. Now we're gonna put them up. And this is not easy. We're gonna try our best to keep them straight and apart. Now we're gonna take one elbow and we're gonna bend it, try to bring it down towards your hip. Now, hold that position. Take your other arm and try to punch the sky. Do you feel that? That switch there? Wow. And then we're gonna come up. Now you're gonna bend the other arm and then punch that top arm. Oof, feel that? And then you're gonna come up. This is our home base, okay? And then we'll bring it down and punch. Oh, feel those abdominals engaging? Down and punch. Oh, fantastic. That's the arms. The legs, it is a march. Now this is not easy. If you can, try to keep your hands up. If not, that's okay. But what we're trying to do is kind of contract our abdominals first and then march. Bring one knee up and then the other knee. Perfect. And I love that nobody's pulling down on their head. If I were to put electrodes all over your body, what we would really want is your abdominals to fire first and then your leg muscles seconds. We know that ataxia, it's not just a lack of coordinating the muscles, but timing them and really rewiring our body and brain to kind of time that core and then the limbs. Stabilize proximally first. So we'll do the arms. I'll do it with you. We'll do the legs and then that coordination part. When one arm comes down, the opposite leg comes up. All right? You got it? Oh, one arm comes down, the opposite leg comes up. Oh, this is so hard. Opposite leg. Good, it's a lot to coordinate, so you're kind of reaching down and up at the same time, okay? Try our best. We'll do it together, okay? All right, just the arms, just the legs, and you can always break it down if you want to do only one or the other, but we've got this. All right. Alex, we're ready. Everyone looks awesome. Okay, we're gonna take one arm, bring it down, punch the other arm up. Awesome. And switch. Really punch that other arm up. Tighten those abdominals. This is the best core workout. Oh, best core workout. Down and punch. Down and punch. Oof, one more. Down and punch. And then the other arm. Down and punch. Oof, amazing. All right, try to keep your arms up so we don't collapse. Ready, bring that knee up and then up. This is very difficult. We really focus on our posture, stabilizing at the core. Awesome. You've got this. Trying not to collapse. One more. Oh, everyone looks awesome. Okay. Ready to try us? Arms are up. All right, try one elbow goes down while the opposite knee goes up. Yes. Down and up. Good, and if you can, try to punch that top arm. Fantastic for our core muscles. Everyone looks so good. Awesome. Tighten those abdominals. Awesome. Oh my gosh, we're almost there. We're almost there. Almost there. Last one. Oh, fantastic. That is not easy. Looks simple, but it's not simple. So very, very good. All right, we have one more exercise, and then we'll talk a little bit more about exercise for genetically inherited ataxias. Okay, so this is our boxing again. It goes hook, hook, uppercut, uppercut, duck, duck. So I'll walk you through it. So we're gonna look over our shoulder if it doesn't make you dizzy. I'll turn this way. And then we're gonna lift up one arm, our elbows up. And we're gonna bring that across our body, okay? Like you're kind of doing a hook almost, okay? We'll go slow when we do it. And then you're gonna take the other arm, keep your elbow up, get those abdominals there, and then come across your body, okay? That's the hook. Go back to your other hand. We're gonna come up for a uppercut. And then the other hand, uppercut. Okay, so it was hook, hook, uppercut, uppercut. And then our duck, duck, but we're going forwards and backwards. Our arms stay. Try to go forwards. Keep your arms there and go backwards. Okay, so let's do it again. We're gonna go hook, ready? Hook, and it is purposely slow. All right, and I'm technically supposed to be turning my head. Hook, uppercut, uppercut. Got those abdominals firing. Ready? Forwards, backwards. Awesome. Okay, that's our routine. We'll go slow together, pick it up a little bit, and then go slow again. All right, Alex, I think we're ready. Okay, ready? Let's go ahead and hook. And then the other arm, hook. Uppercut. Good, keep those abdominals. Uppercut, duck, duck. Awesome. Okay, hook, hook. Good, keep those abdominals firing, hook. Uppercut, uppercut. Duck, duck. Oh gosh, keep those abdominals firing, okay, ready? Here we go. Hook, hook, uppercut, uppercut, duck, ready, duck, ready, hook. One more time, nice and slow. Awesome, everyone looks so good. Hook, uppercut, uppercut, duck, duck. All right, try to go fast at your own pace, okay? Here we go. So it goes hook, hook, uppercut, uppercut, duck, duck. Good, everyone just do your thing. Everyone looks great. Almost, and then we're gonna go back to slow together, okay? Okay, good. All right, ready? Slow. Hook, hook, uppercut, uppercut, duck, duck, hook, hook, uppercut, uppercut. Got those abdominals going? Duck, duck. I think we finished it. Yes, awesome, great job. If you're firing those abdominals, it is a fantastic core workout, fantastic job. A lot of coordination. Okay, number 2, is exercise even effective or helpful for individuals who have an inherited form, maybe genetic, maybe degenerative, progressive? And so that's where we're gonna go into 3 more stories. So we're gonna talk about Sammy and John. Sammy and John were recruited into a study called Cerebellar Ataxia Rehabilitation Trial in Degenerative Cerebellar Disease. So the researchers wanted to know, can intensive rehabilitation be helpful for degenerative cerebellar diseases? And if so, can the gains be sustained? Or is it, hey, we did this exercise program, we found all these improvements, and then we lost, the gains were not sustained. So that is the questions. So they had, Sammy and John were put together with 40 other individuals into 2 groups. Sammy's group started right away. actually both groups did the same thing, but Sammy's group started right away. They did 2 hours of inpatient physical therapy and occupational therapy on the weekdays, 1 hour on the weekends. It was pretty intense. But despite having cerebellar degeneration, they showed significant functional gains in their ataxia, their gait speed, and their ADLs. Improvement of their truncal ataxia was more prominent than the limb ataxia. When they reassessed these individuals 12 weeks and 24 weeks later, their gains were sustained, which is fantastic. After 24 weeks is when people started losing those gains, about 50% at that point, but they were also saying, you use it or you lose it, so keeping up with things. So short-term benefits of intensive rehabilitation was evident in patients with degenerative cerebellar diseases. Although functional status tends to decline at baseline within 24 weeks, gains were maintained in more than half of the participants. So Dr. McQuare, and that's the real doctor's name, so he wanted to look at other diagnosis of cerebellar ataxia. So he took 19 articles, which is actually a lot when you thread through all the number of participants and all the assessments that they did. And so he took all these together, cerebellar ataxia. 5 studies were with multiple sclerosis, 4 with degenerative ataxias, 2 with strokes, and 8 studies with various etiologies, and put them all together and look, can rehabilitation be effective for this population of cerebellar ataxia? And he found there's moderate level of evidence, which is actually really good in the research world, that rehabilitation is efficient to improve postural capacities of patients with cerebellar ataxia, particularly in patients with degenerative ataxia or multiple sclerosis. Intensive rehabilitation programs with balance and coordination exercises are necessary, which is fantastic. And then one of my favorite stories is Dr. Ilg and his colleagues. So this, even though I kind of spoiled the ending on this one, we know the research is strong because the cerebellum has 3 anatomical subdivisions and 3 functional subdivisions. So we kind of know if you have damage to this part of the cerebellum, rehabilitation is pretty effective because you can just reroute around that part. But Dr. Ilg said, what if we have participants who have degeneration in the entire cerebellum, diffuse, and what if it was progressive and degenerative in form? What about, would it be effective for that population? So they had 16 individuals total. 10 individuals had pure progressive cerebellar degeneration, and 6 had degeneration as well, but they included sensory pathways such as Friedreich's ataxia as a form of that. They did 4 weeks of intense coordination training. And despite the fact that these were degenerative, global, diffuse forms, significant improvements were still found and a reduction of their ataxia symptoms. In patients with cerebellar ataxia, coordinative training improves motor performance, reduces ataxia symptoms, enabling them to achieve personal, meaningful goals in everyday life. Dr. Amy Bastian quotes this research study, and she says, this work is she doesn't say so, but this work is particularly exciting because it shows that individuals with cerebellar damage can learn to improve their movements. It's a new avenue for improving motor skills and functional performance in a population of individuals that was previously thought to have little chance of motor recovery. How cool is that? So of course I wanted to know what the exercises were, right, for application. And so I contacted Dr. Ilg, and he sent me to the physiotherapist, Doris Britz, and I went back and forth with her, sending her videos, and I got the exercises they did, the participants, and I uploaded them onto my channel if you want to see them. And then I also took the exercises and put them into a 30-day program. It's not 30 days in a row, and this is all free, by the way. But it's the exact exercises they did, but every day is a little bit different to mix it up so you don't get so bored. So I have all of the resources of the exercises they did and or the exercise program, and that's all free on Little Steps, Big Gains. All right, so exercise is definitely effective for genetically inherited progressive forms of ataxia, which is up and coming and new and exciting. All right, so round 3, our last round of exercise, we're gonna go ahead and do our good morning stretch, okay? We know that one. I wanna provide a little continuity, so it's not so many new things here. And then we're gonna do what's called sweep the honey, okay? Our hands are gonna go up, And we're gonna take one hand and you're gonna reach that hand to the same side. And you're gonna reach it all the way out as far as you can without tipping out of your chair. Keep that arm straight as you go forwards, around to the opposite side, rotate your torso, and then come back to the center. Ooh, that's really difficult. And then we switch sides. Your other hand, reach it to the side as far as you can without falling out and being safe, all the way forwards, all the way around to now you're at the opposite side of your body and then coming back to center. All right, it's called sweeping the honey because it's like we're taking the honey and we're sweeping it, okay? Very, very, very good. And then dancing with rainbows. This is another fantastic exercise. Our arms are up. Now our elbows are back. Oof, feel those scapulas in the back firing for posture. We're gonna extend one arm out and then try to lean towards that side. Reach. Ooh. Keep that elbow back on top, so hard, and then up. Extend your other arm. Reach. Try to keep that elbow back and up. This is not easy. A lot of times we want to kind of collapse. Keep that elbow back. Should feel a beautiful stretch. Fantastic for our core muscles and our posture. It's not easy. That's called dancing with rainbows. All right, we're gonna do 4 of each exercise together. So we'll start with our good morning stretch. Alex, I think we're ready for you. All right, here we go. We're gonna breathe in and out. Squeeze those shoulder blades back and down. Breathing in, breathe out. Good, tightening those core muscles. Fantastic. Breathing in, out. Fantastic. All right, let's sweep the honey. Take one hand, reach it to the side, sweep. All the way forwards around. Now you're at the other side and back. Okay, switch hands. Reach to the side, all the way around, across your body, and back. Okay, reach, sweep. Back up for that posture. Reach, sweep. Oh, fantastic. Reach and sweep. Oh, everyone looks so good. Reach and sweep. One more. Reach and sweep. Back up to center. Reach and sweep. Okay, arms up, elbows back. Breathe in, extend, reach. Oh, keep that elbow back on top. Breathing in and extend and reach. Breathe in. This is fantastic. Breathe out, extend, reach. Everyone's doing fantastic. Out and reach. Out and reach. Out and reach. Last one. Out and reach. All right, good morning stretch. Ready? One more. fantastic. That one is so difficult, so difficult. So fantastic though for our posture and our core stability. Okay, back to coordination. So our hands are up again, just like when we were pulling back. This time, our arm is gonna stay straight as you bring that arm out to the side and back. Now, this is fantastic. If you're leaning back, this is level 1, and that is awesome. Level 2 is unsupported, and level 3 is to add a little bit of rotation to it, and all the way back in. All 3 levels are fantastic. We'll do one side, and then we'll switch to the other side. That's the arms, okay? The legs, pretend like I put a little block next to you, and I want you to try to lift up, over, and out. And when you come out, try not to let your knee collapse and try to keep it out. And then up, over, in. Okay? Up, over, out. Don't let that collapse. Really engage those muscles and in. And once again, we're not collapsing when we do this. We're really tightening our abdominals. So we'll do just the arms, just the legs, and then the combination would be, it's always opposite. So when you take one arm, I'm gonna take my right arm and my left leg are gonna go out. It's opposite, okay? It's not easy, all right? So one arm is gonna move and it's gonna be the opposite leg. This is very, very, very difficult. So if you do the incorrect leg or arm, who cares? Just try your best. Move one arm and the opposite leg. You're gonna move the other arm, one arm, and your opposite leg. This is very, very difficult, so you just try your best, okay? Everyone, give it your best shot. We'll do just the arms, just the legs, and then we'll try both, okay? Whew. All right, I think we're ready, Alex. All right, arm. And then, good, arm, good. I love everyone's keeping those arms straight. Arm. Arm. Arm, yes. I love that everyone's doing at their own challenge. One more on each side of those arms. Is fantastic. Oh, all right, let's get those legs. So try not to collapse. Lift your leg up, over, out. Like I put a step stool there and you gotta go over it. Okay, now your other leg. Out and in. And switch, up, over, out. And you're not collapsing. Keep that knee out. Up, over, out. Up, over, out. Everyone looks so good. Up, over, out. Good, keeping that knee out. Up, over, out. Up, over, out. Oh, fantastic. Now we're gonna try. Just try, all right? One arm comes back and the other leg, it's your opposite leg. Yes. We gotta do 2 more of these. Ready? Out. Tighten those core muscles. Feel that in the core? Whew. Tighten those core muscles. This is a fantastic, we gotta do 1 more. Out. Oh my gosh, this is so good. And out. Talk about coordination, core, posture, everything. Oh, fantastic. One more group exercise. We got to do that boxing. Okay, everyone's doing really good though. So if you want to just take a break, I'll show you this one real quick and then we'll do it together. So it's going to be a cross punch upwards. So I'm going to look up across my body. I'm going to punch up, come back. And then it's the other way. Punch up. Now we got to get our glutes involved, our butt muscles. Our butt muscles help us stand upright. All right, so we're gonna squeeze our butt muscles twice. So squeeze your butt muscles, squeeze your butt muscles. Then we're gonna punch across and down. Whew. Across and down. Okay, now I'm gonna do it fast just to remind you. It goes up, up, butt, butt, down, down. Fantastic, fantastic workout. All right, we'll go slow. Remember, you're like in an action movie, going slow motion. All right, I think we're ready, Alex. Okay, so ready, up and across. Back, up and across. Squeeze your butt muscles, butt, butt, ready, across and down. Oof, across and down, oof, feel that? Oh man, up and across. Tighten those core muscles, core, butt, butt, down, down, up and across, butt muscles, down and across, down. One more time, nice and slow. Up and across, really reach, fire those abdominals, butt muscles, down, down. Okay, if you want, try fast if you can, okay? Cross, cross, butt, butt, down, down, okay? Everyone's doing great. All right, ready? Let you finish where you're at, then we're gonna slow down and do it together. Okay, ready? Across and up. Across and up. Butt muscles. Across and down. Across and down. Across and up. Up. Butt, and then across, down, and down. Fantastic. These are fantastic exercises for our core and our posture. So we talked a lot, so now we know that exercise is effective and can help with both forms of ataxia, acquired, inherited genetic forms, degenerative forms, progressive ones. And so we talked a lot about how when we think of core, we think of crunches, and really what we need is stability. And a big part of that is actually the back. It's our back extensors that help us upright. And so along the back, we have our butts, which we just talked about. And one of the best exercises that you can do for your butt muscles is honestly sitting and squeezing them. They've done a ton of research studies on what exercises recruit what muscle groups. And just sitting glute squeezes is extremely effective. And that's exciting because that's super easy. Okay, so a few quick stories here, and then we'll get back to the back of the posterior chain. So Dr. Amy Bastian and Jennifer Keller did this fantastic research program or study, a home balance program. And I love this because they gave these exercises to individuals at home. They were not supervised. This was not in a therapy clinic on their own. And they had 14 individuals with cerebellar ataxia. They did these exercises sitting on a firm surface or a balance ball if they wanted, standing on a firm surface or an air pad, and then stepping, and they held on to something. These individuals did this home balance program and didn't do any walking. And yet, when they assessed their walking before and after, they improved in their walking. And that's what's so exciting is we can work on our core stability, and that can help with our mobility. And so we don't necessarily always have to do walking exercises to work on walking. And that's what I do with my patients. I walk with them, but then I give them these core exercises to do on their own because it all translates over. In order to apply that, what I did is I actually took the exercises from this research study, and I also put them online if anyone's interested in doing these exercises. And then I also put them on a 30-day program, and that one's called the Stability for Mobility Challenge. And so it's 30 days, not in a row, but 30 days of exercises from this research study. Next story is Pam. Pam is older, but she was recruited into a research study because she has rounded shoulders, and her rounded shoulders are from weakness in her scapulas. So she was given a program to do with TheraBand, solely focusing on the scapulas. That's it. Scapular adduction. In other words, bringing that scapula back and back and back. And her and the other individuals of the study, they improved in their standing balance. And you're saying, well, what were the balance exercises they did? They didn't do any balance exercises. They only worked on their scapulas. That's it. And a large part of that is when we have weak scapulas, it brings us forward into this rounded position, and it shifts us forwards. And now when we're standing, we're shifted. All of our weight is on our toes. It's hard to stop. It's hard to maintain our stability. So even just working on our scapulas for our posture is so fantastic, and that's considered part of the core. You know, we think core here, it's a cylinder, okay? So that can be fantastic as well. So the study said the effect of scapular strengthening exercises using an elastic band on balance and quality of life. And they did do this with older people, but that's just because of the rounded shoulders. One more story, or two more stories. Sarah, she's 19 years old, genetically inherited progressive ataxia. She went to physical therapy, and she just worked on her neck muscles, which we're thinking, I'm here to talk about core, Elizabeth, not my neck. She worked on her neck muscles, her scapulas, and her posture. And she found that when she did those things afterwards, she had improvements in her posture, right? Her fine motor dexterity. She had to do this PEG test. She improved in her fine motor skills. Her balance improved significantly in her quality of life. And you're thinking, why in the world would neck exercises help with fine motor control? Our neck plays a huge role in our body's position sense of where it is in space. It has these things called proprioceptive receptors. Are you forwards, to the side? And so she did a lot of strengthening to bring that neck back. And one of the best ways to do this is the most unflattering exercise, the chin tuck. You take your chin and you tuck it back and down. It's not down, but it's back. So you give yourself a double chin. One of the best exercises that can really help with your neck stability. She worked on those scapulas and she worked on her posture. Fantastic. Okay, and then one more story is Sean. Sean was a 22-year-old male. He has multiple sclerosis and tremors in the right hand. And they assessed his fine motor coordination. And then they worked on his scapulas and his deep neck flexors. And then after his, well, I did a week, but after his exercises, he improved in his fine motor coordination of that right hand. Just showing how when we work proximally on the core, on the posture, it can help us with things like distal coordination, walking, reaching. It's all connected, which is fantastic. So if you're interested in my channel, Little Steps, Big Gains, I have sitting tai chi, standing tai chi. I have tai chi walking, which is fantastic. And my friends that do tai chi walking with me, they do it along something like a countertop. 5 minutes of tai chi a day, because that's a lot easier to do in there. The balance with a broom, which is kind of the coordination exercises if you liked that. The household hustle, I use household objects like peanut butter and mouthwash. The static standing balance challenge, that is from research on sensory reweighting for ataxia. The intensive coordinative training challenge, that's from that research article by Dr. Ilg and his colleagues. The stability for mobility challenge, those exercises are from Dr. Amy Bastian and Jennifer Keller for progressive ataxia. And then the better balance for ataxia challenge. It is specific to ataxia because there's just not enough out there for it. You can Google exercise and you'll find Parkinson's and multiple sclerosis. So this is better balance for ataxia. It has 5 levels. You can do it sitting in a chair supported, leaning back. You could do it unsupported. You can do this in standing. You can do this standing, holding on or letting go. And then you can do level 5 is a little advanced, but it's letting go and it's an added challenge on that. So it is inclusive for everybody, no matter where your mobility level is. So that is Little Steps, Big Gains. It's free. And then my little sister is actually Dr. Allison Hilger, who just talked to you up here. That's my little sister. At her table out there, there is a QR code for anyone interested. Everything is free. So I hope that you enjoyed a little bit of core strengthening, learned some exercises, and have more resources. And thank you for your time in coming.